Hello and welcome to JA Explained. This is an episode all about juvenile arthritis pain and how you as a caregiver or parent can help your child or loved one better manage it. I'm Corrine Pinter. I am an active volunteer at the Arthritis Foundation. I have a daughter, Emily, who is 15, who is diagnosed at 2 with polyarticular arthritis, and she currently has psoriatic arthritis. So I understand how distressing it can be to watch your child struggle in pain and feel like there's nothing you can do to help. Our guest today, Dr. Cara Hoffart, will share advice on how we as caregivers can help our loved ones live better with pain so that we in turn can all breathe a little easier. Dr. Hoffart is a pediatric rheumatologist and director and founder of the Rehabilitation for the Amplified Pain Syndrome RAPS program at Children's Mercy Hospital in Kansas City. It is one of only a handful of pediatric pain rehabilitation programs in the country and helps children with chronic pain redeem their lives through functional approach. Additionally, Dr. Hoffart serves as director of the Pain Management Clinic at Children's Mercy and is an associate professor of pediatrics at the University of Missouri, Kansas City School of Medicine. Dr. Hoffart, welcome.
Thank you for having me.
Lifestyle changes, complementary therapies. There's a lot of talk about diet or eliminating things or adding things, adding supplements. Should I do acupuncture? Should I get massage? What kind of things in conjunct to what you're already doing could be helpful, or could things actually worsen the condition? And what one person thinks is helpful, is it actually going to make things even crazier than they already seem to be?
Yes. So I definitely think there are things to try. One thing, if someone has an amplified pain flare, whatever you decide to do, I recommend that you schedule it and that you don't do it as needed in response to symptoms. So it's better to have things just in a scheduled manner, because otherwise your brain will check in and be like, how are you doing? How's your pain? Do you need this? How are you doing now? Now, do you need this? And so instead, it's better to have it just scheduled so your brain doesn't have to check in on symptoms in the same way. And so like even for, naproxen or something, I'd rather you schedule it than do it as needed when there's an amplified pain component. And so as far as diet goes, certainly I have a lot of patients that try different things with diet. So there's nothing great and proven per se. That being said, we know there are diets, anti-inflammatory diets out there, and that's definitely a hot topic. I sort of pick which hill I will die on, especially with my teenagers.
Yes.
And if they want to try it, that is totally fine. But I also, they're going through a lot already and giving things up, and life is hard. And, do I really want to say you can't, have a cheeseburger or a piece of pizza?
Right.
So I think balancing that out, and most, and I even have patients that they have, they're have some lactose intolerance, but they're still going to eat ice cream because they know they're going to pay the price, but they'd rather have that ice cream. And I would say that's your prerogative. That's okay. And that's working towards adult decision making, right? And so I think those are important independent skill sets to be developing. But certainly we know foods that are high in fried foods or high sugar foods, especially, those types of things kind of feed your immune system and keep it overactive. And so in general, we can all benefit from healthy diets. So, lean proteins, fruits, vegetables, whole grains, and really it comes down to everything in moderation. And so I don't typically ask my teens to do anything restrictive, but we do talk about just overall nutritious eating. And especially if your arthritis is flaring too, you just want to make sure that you are giving the nutrition your body needs to heal. And so while it's tempting to go for the comfort food, making sure that you're getting a good balance of nutrition. There is a tiny bit of data out there about the benefit of like omega-3 in arthritis. So I certainly let families know they could try that, which is just an over-the-counter vitamin. And then there's some data about the supplement magnesium, just for especially improvement for like headaches, but also just nerve calming agent. And so it also can can help if you're constipated. So it does a few different things. So there may be side effects too. And so some people really like using magnesium over the counter and they feel like it is really helpful to them, and other people notice nothing. So I think there are things to try. And in the same way, some of my patients feel like acupuncture is so helpful for them, and there is some data behind it. And then I have other patients that do it and it actually like flares their pain and they don't like it at all. And so you end up just not really knowing until you try it. I would say you don't technically need most of those things to get better, but if there are things that you enjoy or they feel helpful to you, I think it is totally fine. And most of those things are not at all dangerous.
Yeah, and I think that's the one thing is like you said, like there are many options and there's not a one size fits all for everyone. And we know that with medications and treatment plans, so it's best to kind of find what works for you, but also still be in consult with you as the provider. Cause I know a lot of times people just want to pull things in and do it and think they're doing great and everything. And if you don't know, it's kind of hard to track progress too, because you might think the plan you've provided is amazing and working and great for the kid, but they're doing A, B, C, D, E, F, G too, that complements it as well. And I think or families have questions like, will this supplement work? Or, I thought of that with acupuncture too. I thought, wow, that could either ramp up somebody's nerves as well, or it could maybe calm them down. So it's very individual, which is also tricky because we all want a magic fix and there is literally nothing, but healthy lifestyle and healthy choices is good for anybody. And just, moderation too, because I mean, who just wants to not treat themselves sometimes? And sometimes that ice cream or that cheeseburger is going to calm your mind and make you quiet to reset and just get onto your next thing.
There's a time for everything.
There is a time
and
for
I love
everything.
your point about looping in your provider. And I think sometimes it can feel scary to do that because you're not sure what they're going to say or if they're going to agree or if they're going to think it's silly. But we actually really want to know and we want to have those conversations. And there are some things that we feel like we need to do as far as like the, medications or potentially injectables or things like that. But there are certainly a lot of other things like, let's talk through it. Let's see what the options are. Maybe it'll help, maybe it won't, but it probably won't hurt anything. And so we're happy to have those conversations and to make sure nothing's interacting and that everything is working together. So I appreciate you bringing up that point.